You're a nurse, Amina, not a diagnostician, not a physician, not someone trained to make medical decisions. The sound of panic pulsed through the hospital hallway, the kind of panic only heard when someone's life hangs by a thread. Nurse Amina Caldwell stood at the nurse's station, clutching a patient chart so tightly her knuckles whitened. Her breath trembled, her eyes glistened, but she refused, absolutely refused, to let the tears fall. Not here, not in front of him. Dr. Liam Hargrove, as the hospital's golden boy, marched toward her with the swagger of a man who had never been questioned a day in his life. His lab coat swung behind him like a cape. His stethoscope gleamed, new, expensive, symbolic. He loved symbols, power, status, control. He leaned over her desk, voice smooth as polished marble but cold enough to burn. 2 interns snickered behind him. A janitor paused mid-mop. Even the security guard looked up. Amina swallowed hard. "Doctor, I'm only saying the patient's oxygen drop is inconsistent with what the monitor is reading. I think we—" "You think?" He laughed. "Let me make something very clear." He placed one hand on the desk, leaning in closer. "You bring me vitals. You take blood pressure. You follow orders. I don't need suggestions from someone who—" He hesitated, just long enough for everyone to understand exactly what he meant. "Someone who looks like you." The silence cracked like glass. Amina didn't flinch. We didn't blink, didn't give him the reaction he wanted. She simply repeated, steady and calm, "The patient is crashing, Dr. Hargrove. Something is wrong." He waved her off like she was an annoying fly. "Stick to your job." Her jaw tightened. "My job is saving patients." "And mine," he snapped, "is making medical decisions you can't possibly understand." A few nurses exchanged glances. Uncomfortable, knowing, exhausted glances. They had seen Dr. Hargrove talk down to staff before. But he was always harsher with Amina. Always. And always when someone was watching. "Doctor," she tried again, voice firm but respectful. "His symptoms match internal bleeding. We need to call for a trauma consult." "Amina." His smile didn't reach his eyes. "Do you want to keep your job?" The interns giggled again. There it was, the humiliation. The card he always played. The unspoken words, "Know your place." She stared at him. Then something strange happened. His pager buzzed. Once, twice, frantically, and a voice crackled through the intercom. "Code blue, room 418, code blue." Room 418. Her patient. The one she had been warning him about. Dr. Hargrove froze, just for a second, before rushing down the hallway. Amina didn't hesitate. She ran. They burst through the patient's door simultaneously. But she reached the bedside first. Mr. Bennett lay gasping, his body soaked with sweat, pupils glassy, skin graying by the second. The beeping monitors screamed in alarm. He was dying. Fast. Amina's voice cut through the chaos like a blade. "He's bleeding internally. We need to open an emergency trauma protocol now." Dr. Hargrove barked back, "It's a simple arrhythmia. Push another round of amiodarone." "That will kill him," she snapped, and for the first time in 7 months she raised her voice at him. The room fell silent. Nurses looked between them. Dr. Hargrove's face darkened. "You don't give orders." His voice dropped low and dangerous. You don't raise your voice at me, and you certainly—" Then it happened. Mr. Bennett's heart flatlined. The monitor emitted a single, piercing note that ripped through the air. Amina didn't blink, didn't breathe, didn't wait for permission. She moved, and in that moment, that one, blazing, terrifying moment, her instincts, her training, her experience, her brilliance took over. Dr. Hargrove saw something in her he had never seen before. Authority, certainty, power. And she grabbed the crash cart herself. "Move," she ordered, voice sharp and commanding. The staff obeyed. Not him. Her. Amina reached for equipment, her hands steady, rapid, practiced. Scissors, gauze, suction. The team responded instantly. Dr. Hargrove stood frozen, watching. The black nurse he just humiliated was about to save a life he couldn't, and everyone knew it. Chaos thundered through room 418, but inside Amina Caldwell, everything became razor sharp. Every heartbeat, every breath, and every second slipping away. She didn't hear Dr. Hargrove's objections. She didn't notice the interns whispering. She didn't see the nurses exchanging stunned looks. She saw one thing: a man dying because her expertise was ignored. Amina snapped on sterile gloves, her voice steady as a surgeon's hand. Prep for an emergency thoracostomy. Dr. Hargrove jolted as if waking from a trance. What? He sputtered. Are you insane? You're a nurse. You don't do invasive procedures. He's hemorrhaging into his chest, she said firmly. We're losing him by the second. You're not qualified? Then you do it, she fired back. Silence slammed into the room. Everyone turned to him, and for the first time, they saw something behind his pride. Not authority, not confidence, not command. Fear. A deep, shameful fear. Because he knew, and they all knew, he didn't know how to do it. He'd never done one alone. He didn't have the steady hands. He didn't have the instincts. He didn't have the nerve. He only had arrogance. Amina grabbed a scalpel. Get out of my way. And she didn't wait for him to move. She pushed past him. Nurses followed her like she was the attending. The room shifted. The power shifted. The truth shifted. Amina placed her fingers along the patient's rib cage, finding the precise landmark with acute precision. Scalpel. A nurse placed it in her hand. She made one clean incision. Clamp. Another tool snapped into her palm. Get me suction. He's drowning in his own blood. Red fluid spilled outward, proof of everything she'd been saying. Proof that the patient would have died if they followed Hargrove's order. Proof that the nurse he humiliated knew more medicine than he did. A resident gasped. She's right. Massive hemothorax. She's done this before, another whispered. Amina didn't look up. Tube. She slid the chest tube in with flawless precision. The room erupted with gushing fluid, suction pulling out the blood that had been choking his lungs. Within seconds, actual seconds, the flatline began to bounce, then stabilize, then rise. A heartbeat, a real heartbeat. Mr. Bennett gasped, coughed, breathed. He was alive, alive because of her, and because she didn't listen to the man who told her to know her place. But Dr. Hargrove wasn't relieved. He wasn't grateful. He wasn't humbled. He was furious, humiliated, exposed. He stormed up to her as she finished dressing the wound. You just violated protocol, he hissed. You practiced medicine without authorization. You're finished here. His voice was shaking, with rage, with fear, with ego bleeding out onto the floor. Amina looked at him calmly, deadly calm. You were going to let him die. You don't get to decide that, he snapped. Then who does? Amina demanded. Someone who won't listen? Someone who refuses to see past a nurse badge, or past my skin? The room went still. His face twitched, jaw tightening. I'm reporting you, he whispered. You're done. Amina didn't blink, didn't flinch, didn't look away. Do what you must, she said softly. But understand this. She stepped closer, her voice low enough that only he could hear. You didn't lose control of this room because of me. You lost it because your staff saw you panic. He froze. You lost it, she said. Because they realized I saved a life you didn't know how to save. His expression crumpled. Fury, embarrassment, and the first flicker of something else. Something unfamiliar to him. Guilt. Amina turned away from him. "Get this man transferred to ICU," she told the staff. "Page trauma surgery, and someone please document everything accurately." The nurses immediately moved, not because she outranked them, because she had proven she led them. Dr. Hargrove stood alone, the golden boy, the rising star, the man who thought he owned the hospital. He stared at his trembling hands, the hands that couldn't do what hers just did. As the patient stabilized, Amina gathered her notes, removed her gloves, and walked quietly out of the room. Her chest heaved. Her palms shook. She had just broken a dozen rules. But she had also saved a life, and in a hospital that judged her by her race before her credentials. Saving a life wasn't always enough. Down the hall she heard heavy footsteps, the kind of footsteps that meant trouble. She turned. Dr. Hargrove was marching toward her, face red, breathing hard, eyes full of vengeance. He wasn't done, not by a long shot. And Amina knew the real battle was about to begin. The hallway felt colder than usual, not because of the AC, but because Dr. Liam Hargrove was storming down it like a man whose ego had been stabbed clean through. Amina braced herself. He stopped just inches from her, too close and too aggressive, the way men in power get when they finally feel powerless. "What you did," he hissed, "was reckless, illegal, and dangerous." "What I did," she replied evenly, "was save a patient's life." "You overstepped. You underperformed." The words cut him so sharply that his jaw clenched. "You think this is over?" he snapped. Amina exhaled softly. "No, Dr. Hargrove, I think it's about to start." He stepped closer. "I'm filing a report with administration," he said. "Effective immediately." Amina didn't blink. "Then file it," she said. "But be sure to include your part, too." He scoffed. "My part?" She lifted an eyebrow. "The part where you ignored critical symptoms, where you dismissed vital signs, where you refused a trauma protocol out of arrogance, and the part where you nearly killed a patient because you refused to listen to a black nurse." His face turned a dangerous shade of red. Staff nearby stopped pretending not to listen. "Yes," Amina said louder for everyone to hear. "Make sure you include all of that in your report." A nurse stifled a gasp. An intern pretended to cough, covering her grin. Even the janitor paused. Something shifted in the hall. The fear that usually protected him, gone. The silence showed it. The staff had seen enough, tonight and over the months, and they were done. He tried to recover his footing. "You think anyone will take your side over mine?" Amina took a step closer. Her voice dropped into something quiet enough to be deadly. "Yes." Because she knew something he didn't. "Dr. Hargrove?" A crisp voice echoed down the hall. He stiffened. Amina's head turned. Approaching them with purposeful steps was Ms. Karen Idris, Chief Nursing Administrator. Respected, feared, and notoriously fair. "Hargrove," she repeated. "I heard you needed to file a report." Amina folded her arms. Hargrove straightened immediately, smoothing his coat. "Yes, actually. Nurse Caldwell performed a—" But the administrator cut him off. "Save it. I already spoke to the ICU team. They said Nurse Caldwell performed a flawless emergency thoracostomy." Amina's eyebrows lifted. "You spoke to them already?" Ms. Idris nodded. "We have real-time charting records, Nurse Caldwell. Everything you did was documented automatically as you performed it." Hargrove flinched. "And the ICU attending signed off on your intervention." A ripple of shock ran through the hall. Amina blinked, stunned. "I didn't think—" "You didn't think your NIMS trauma training would ever be acknowledged at this hospital?" Ms. Idris said gently. And that was true, because for 2 years, her credentials were overlooked. Her prior military EMT experience ignored. Her advanced trauma certification dismissed as not relevant. Amina felt something warm climb into her chest. Validation. "Now," Ms. Idris said, turning to Hargrove, "you claimed Nurse Caldwell violated protocol. So let me ask you something." Her eyes sharpened. "What was your diagnosis?" Hargrove swallowed, hard. "I believed it was a cardiac arrhythmia." "And were you aware of the CT scan request placed earlier by Nurse Caldwell?" Hargrove froze. Amina raised her chin. "Yes," she said. 3 hours ago." Ms. Idris nodded. "And did you cancel it?" Silence. All eyes on him. "Yes," he finally muttered. "On what grounds?" He hesitated, then made the worst mistake of his career. She's a nurse. They make mistakes all the time." A collective inhale swept through the hall. Even he realized what he'd just said. Ms. Idris stepped closer, voice ice cold. "Nurse Caldwell has saved more lives in trauma situations than most first-year residents. Your decision to cancel her request put a patient in life-threatening danger." He opened his mouth, but she wasn't done. "And you escalated that danger by dismissing her findings, ignoring her experience, and belittling her in front of staff." His throat bobbed. I was following protocol." "No," she snapped. "You were following your bias." The hall went dead quiet. He blinked. "What bias?" She held his gaze. "Your bias against nurses. Your bias against women. Your bias against black staff." The words rang through the corridor like a gavel strike. Amina exhaled slowly, her lungs finally expanding. Ms. Idris wasn't finished. "You will be placed on immediate administrative leave pending investigation." Gasps, whispers. A nurse put a hand over her mouth. Hargrove shook his head in disbelief. You're suspending me," he stuttered. "Oh, absolutely." Ms. Idris folded her arms. "And I suspect the board will be interested in how many of Nurse Caldwell's clinical notes you've ignored over the past months." His eyes widened. How do you know about that?" Amina answered. "Because I documented everything." His breath hitched. "You kept records on me." "No," she corrected softly. "I kept records on your decisions." A beat. And on the patients who paid the price. He was shaking now, literally shaking. His career wasn't just threatened. It was cracking, crushing, collapsing. Before he could muster a defense, a trauma surgeon jogged down the hall. "Where's Nurse Caldwell? ICU needs her. The patient's asking for her." Amina blinked. "Mr. Bennett is awake." The surgeon nodded. "Awake and talking. He's calling you his guardian angel." A warmth bloomed inside her. She started down the hall, then she paused, looked back, looked straight at Dr. Hargrove. "You mocked my suggestion," she said quietly. "You humiliated me. You used your title to silence me." She took one step forward. "And even after you tried to break my confidence, I still saved your patient." He looked at her with something new in his eyes. Not anger, not arrogance, not superiority, fear, shame, and the realization that the nurse he underestimated was better than him. Amina turned away, walked toward the ICU doors, and as they swung open, every nurse watching her felt it, the rise, the shift, the moment when the overlooked becomes undeniable. Amina Caldwell wasn't just a nurse. She was the kind of nurse doctors learned from, the kind that kept hospitals running, the kind that history tried to erase, but couldn't. The ICU doors hissed open as Amina stepped inside, the beeping machines forming a soft electronic heartbeat to the tension still wrapped around her chest. But this time, the hallway didn't feel cold. It felt expectant. Nurses glanced up from their stations, not with pity or fear or the quiet sympathy they often reserved for her after one of Hargrove's verbal assaults. Number. Tonight, they looked at her like someone who had just become something more, essential, respected, unignorable. Yet a nurse waved her over. "He's awake," she whispered. "Asking for you." Amina nodded, smoothing her scrubs, steadying her breath, and walked into the patient's room. Mr. Bennett lay propped up on pillows, his chest heavily bandaged, a drainage tube still in place. He was pale, but awake, and alive. Very alive. His eyes widened the second he saw her. You're the one," he rasped. "You saved me." Amina smiled softly. "We saved you, Mr. Bennett. It was a team effort." He shook his head slowly. "No, I remember hearing you arguing. You were trying to help me, and his face tightened. He wasn't listening." Amina swallowed. "I'm just glad you're with us." Mr. Bennett reached out a trembling hand. She took it gently. "If you hadn't done what you did," he whispered, voice cracking, "my daughter, she would have lost her dad tonight." Emotion hit her unexpectedly. Sharp, warm, overwhelming. A tear slid down her cheek. She hadn't realized how deeply she needed to hear that, and how deeply she needed someone to acknowledge the pain she carried every day, the pain of being treated as invisible until the moment crisis exposed the truth. "Thank you," she whispered. A knock sounded on the door. "Amina," a nurse said softly. "The family wants to speak with you." She stepped into the hallway, expecting fear, questions, maybe even misplaced anger. Instead, she was met with a teenage girl rushing toward her, arms outstretched, pulling her into a fierce hug. "Thank you," the girl sobbed. "You saved my dad. You saved him." Amina froze for a moment, then hugged back, eyes welling. "He's going to be okay," she promised. The girl's mother stepped forward next, eyes red but warm. "You fought for him," she said. "You fought when someone else tried to brush you aside." Amina inhaled shakily. "That's my job." "No," the woman corrected gently. "That's your heart." She reached into her purse and handed Amina a small card. "If the hospital doesn't treat you right after this," she said softly, "my brother is a civil rights attorney, and he would love to meet you." Amina blinked, stunned. I don't know what to say." "Just keep doing what you're doing," the woman said. "You're extraordinary." Amina watched them return to the room. Her hands trembled, not from fear this time, but from the sudden weight of being seen. When she turned back toward the nursing station, Ms. Idris was waiting. "A moment?" she asked. Amina nodded. They stepped into her tiny office, the hum of overhead lights filling the quiet. Ms. Idris gestured for her to sit. "What you did tonight," she began, "was extraordinary." Amina lowered her gaze. "I broke so many rules." "You upheld the one rule that matters most," the administrator said gently. "Save the patient." Silence settled. Then Ms. Idris opened a file. Amina frowned. "What's that?" "Your personnel file," she said. Something I've been meaning to discuss with you for a long time." She slid a stapled paper across the desk. Amina scanned it, then froze. It was her old military record, her trauma certification, her commendations, records this hospital had once ignored. Why didn't you ever bring this up?" Amina whispered, throat tight. Ms. Idris sighed. "You transferred here 3 years ago, right?" Amina nodded. "And what did they tell you?" Amina's jaw clenched. That my military experience didn't count toward advanced placement. That I needed to prove myself first. "And you've been proving yourself," Ms. Idris said quietly. "Every day, to people who never intended to see you." Amina swallowed hard. "There's more," Ms. Idris added, sliding another paper. "A competence evaluation." Amina's eyes widened. She read it, then read it again. "I never saw any of this," she whispered. "No," Ms. Idris replied. "Because I intercepted it before it reached administration." Amina looked up sharply. Intercepted. What? Ms. Idris leaned forward. Hargrove filed 3 negative evaluations against you. Amina's breath caught. What? All unsigned, she continued, all unverified, all vague, and all written after situations where you were correct and he was not. Amina felt the room tilt. He tried to sabotage my record. For months, Miss Idris said, not because you were incompetent, but because you outperformed him, because you had instincts he doesn't, because you have experience he lacks, and because he could not handle the idea of a black woman excelling in areas where he stumbled. Amina gripped the armrests, emotions storming through her. But you're safe, Miss Idris said softly. I've been protecting your file, and after tonight, everything changes. Amina wiped her eyes. All this time, she whispered. All this time he tried to keep you small, the administrator said, but you were too big for the box he built. Downstairs, Dr. Hargrove sat alone in a conference room. Lights off, hands shaking, mind spinning. He'd spent his entire career believing he was untouchable. Tonight shattered that illusion. He replayed everything. Every moment he belittled her, dismissed her, mocked her, cut her off. Every time she outperformed him, every time she made the right call. And he saw it now. His arrogance wasn't confidence. It was fear disguised as superiority. For the first time, he wondered if he had ever been the brilliant doctor people claimed he was, or if he just benefited from a system that always lifted him up while pushing people like her down. He covered his face with trembling hands. He wasn't the victim tonight. He was the problem. He was the danger. He was the reason a man nearly died, and the realization broke something inside him. Later, as Amina walked down the hallway toward the elevators, exhausted but steady, she heard slow footsteps behind her. She turned. Dr. Hargrove stood there. No arrogance, no ego, no armor. Just a man stripped of the illusion of superiority. He approached hesitantly. "Amina," he began, voice barely above a whisper. She didn't respond. He swallowed hard. I'm sorry." The words were quiet, but they were real, raw, painful. "I was wrong," he said, breathing shakily. "Not just today. Every day. I treated you like you were beneath me because it helped me ignore how unsure I really was." Amina stared at him, expression unreadable. He continued, voice tight. "You saved him. I would have killed him, and you didn't rub it in. You just did what was right." He looked down. "I don't deserve your forgiveness," he said, "but I needed to say it anyway." Amina exhaled, emotions stirring. "I didn't do it for forgiveness," she said softly. "I did it because a man was dying." He nodded, eyes wet. "I know." Amina paused, then said something she had never expected to say. "I hope you learn from this." He swallowed hard. "I already have." And she believed him. Not because he said it, but because the defeat in his voice was the kind that only comes when a man finally sees himself clearly, and doesn't like what he sees. Amina stepped past him, and for the first time, he moved out of her way. Morning sunlight poured across the hospital lobby like a quiet promise. Soft, golden, cleansing. But for Amina Caldwell, this morning felt different. Lighter, stronger, fuller. Last night had shaken the entire hospital. Today, the consequences would land, and the world, her world, would never be the same. At 7:15 a.m., an announcement crackled over the intercom. "Attention staff, all nursing leaders and medical directors, please report to Conference Room B for an emergency briefing." Whispers rippled through the hall. Amina felt her stomach tighten. "Ms." Idris approached her with a small smile. "You're coming with me." Amina blinked. "What? I'm not leadership." "You are today." Those words sent a quiet shock through her chest. She followed her down the hall, nerves buzzing. When they entered conference room B, the room fell into a hush. Every department head was already seated, every attending physician, every nurse manager, the hospital's chief medical officer, even the CEO, and they all looked up at her. Not with judgment, not with pity, with respect, deep, unfiltered respect. A chair sat at the front of the table. Miss Idris gestured. "Amina, sit." She hesitated. "Sit," the administrator repeated gently. "You earned it." Amina lowered herself into the seat. Her heart pounded. The CEO stood first. "Last night," he said, "this hospital narrowly avoided a catastrophic loss, a fatality." Silence. "And the only reason that patient is alive," he continued, eyes sweeping the room, "it is because Nurse Amina Caldwell recognized what none of us did." Dr. Hargrove sat in the corner, hands folded, eyes on the floor. The CEO went on. "We have reviewed the footage, EHR entries, witness statements, and ICU reports. What happened last night is clear." A deep breath. "Systemic bias nearly killed a patient. Skill and courage saved him." Amina's heart thudded. "We cannot," the CEO said firmly, "operate a hospital where critical voices go unheard. So today, we begin correcting it." He turned toward Amina. "Nurse Caldwell, we want to formally apologize on behalf of this entire institution." A gasp rippled across the table. A hospital-wide apology? Unprecedented. Amina's throat tightened. "Furthermore," the CEO continued, "we are implementing 3 immediate changes." He lifted 3 documents, and the room leaned in. The CEO read the first document. Effective immediately. Nurse Amina Caldwell is promoted to clinical nurse specialist in trauma and emergency response. A stunned silence filled the air. This was a leadership role, a prestigious one, a position usually reserved for nurses with decades of seniority. "You will oversee protocol updates, mentor junior staff, and consult on high-risk cases," the CEO said. Amina's eyes widened. I don't know what to say." Ms. Idris squeezed her shoulder. "Say yes." Amina breathed out shakily. "Yes." The CEO lifted the second document. "We are instituting a mandatory bias interruption protocol. Nurses will now have the authority to call for a clinical pause if they believe a patient is being misdiagnosed or dismissed." A murmur spread. A clinical pause was powerful. It gave nurses the power to stop physicians, even senior physicians. "For too long," the CEO said, "this hospital has operated under outdated hierarchies that silence frontline staff. That ends today." Amina watched the older nurses wipe tears. The CEO held up the third document. "And lastly, an independent review panel will investigate Dr. Liam Hargrove for misconduct, workplace harassment, and dangerous clinical decision-making." The room tensed. Hargrove lifted his head, defeated, hollow. "I understand," he whispered, and from the brokenness in his voice, he meant it. This wasn't a slap on the wrist. This was career-changing, life-changing, and deserved. And the CEO looked at Amina. "You've carried burdens this hospital never acknowledged. You've endured disrespect you did not deserve. And last night, you displayed clinical brilliance under pressure, while being actively undermined." He paused. The silence thickened. "Today, that ends." He stood straighter. "And today, this hospital stands with you." Then something extraordinary happened. One nurse clapped, then another, then an entire row of nurses, then doctors, then administrators, until the entire room rose, applauding the black nurse who had been overlooked for so long. Amina's breath shook. Her eyes stung. Her chest felt too full. She covered her mouth, overwhelmed. It wasn't applause for saving a life. It was applause for surviving a system built to diminish her. After the meeting dismissed, Amina stepped into the hallway, heart still fluttering. She nearly bumped into Hargrove. He looked smaller, tired, human. "Amina," he began. She sighed. "Liam, you already apologized. You don't need to." "No," he said softly. "I do." He swallowed. "All my life, I was told doctors were the smartest people in the room, untouchable, superior, and I believed it, especially when it came to black nurses." The hallway stilled. Amina's breath caught. "I let that belief dictate how I treated you," he said. "You were better than me, and that terrified me, so I tried to shrink you." A tear slipped down his cheek. It almost cost a man his life. Amina stared at him, shocked at his vulnerability. "I don't expect forgiveness," he whispered. "I only hope you rise higher than I ever did, and become the example I failed to be." Amina exhaled softly. "Liam, growth starts here. Don't waste it." He nodded, and for the first time, he stepped aside, giving her the hallway. That night, as the sun dipped behind the skyline, Amina visited the quiet room, a place nurses used to cry, breathe, or pray between crises. She sat in the corner, hands folded, thinking of every nurse who was silenced, everyone dismissed, every brilliant mind overshadowed by hierarchy, every black nurse overlooked because of her skin. She whispered, "This isn't just for me." Her promotion, the new policies, the investigation, the respect, all of it was bigger than her. She closed her eyes and let the warmth of justice settle into her bones. For the first time in a long time, she felt powerful. Not because the hospital finally recognized her, but because she never needed their recognition to know her worth. Tonight simply made it undeniable. Some stories break you before they build you. Some walls must crack before light gets in. And sometimes, the person everyone tries to silence becomes the voice that changes everything. Remember this: being overlooked does not make you unqualified. Being underestimated does not make you unworthy. Being dismissed does not make you wrong. Sometimes the loudest person in the room isn't the smartest. Sometimes the quietest person is carrying the entire room. And sometimes, the nurse they insult, ignore, or underestimate is the only one keeping them alive. Thank you for staying with me till this very end. Please subscribe, hit the bell icon, and share your thoughts with us in the comments. We promise to keep bringing you stories that heal hearts and inspire change.